Let me open up with a little story. You're standing in an emergency room. The patient lying on the emergency room table in front of you is having a stroke. Time is running out. You, an emergency medicine resident, know you need to send the patient for a CT scan. But when you look over at the computer screen at the side of the room, you see a pop-up message demanding Bitcoin payment. A few minutes later, you're told that the same message has shut down the scanner. That means you'd have to help the patient without knowing whether the stroke was caused by a bleed or a clot, information that's usually vital to the course of treatment. After a few minutes of frantic workarounds, the patient, actually a medical test dummy in this case, is wheeled out of the room with prognosis of survival with serious brain damage. The flashing ransom note is part of a simulation designed to expose physicians like you to the very real threat of cyber attacks in their hospitals. This is unfortunately the world we'll live in, and this is exactly the sort of work I do as a global CEO at Wembley Partners. We're a global cybersecurity products and services firm that I've co-founded just about 3 years ago with a focus on high-touch, high-impact work within the high-tech, public, financial, and especially healthcare domains. We've grown fast, been recognized as an industry top 100 player and a top employer as well, just recently. With offices in 3 countries at this point, we're working on just solving what we call an expensive problem. It's a hashtag expensive problem. That's our focus. With over 50 major global clients, including Fortune 500 companies and governments, to solve some of these most expensive problems related to cyber risk. And that's exactly what I want to discuss today, healthcare and cybersecurity problems associated with it, because obviously, well, we're in the midst of a global pandemic, and we're going to touch on that later. And it's been estimated that lost or stolen PHI, so that's personal health information, may cost the US healthcare industry alone up to $7 billion annually. And that was during the better of times. And again, I don't need to remind you that we are in the midst of a deadly pandemic that has claimed many lives and caused unimaginable socio-political, financial, psychological ruin. Healthcare's response to the pandemic is a mass migration to cloud services at a speed not conducive to best planning. Mistakes are likely to be made, as the adoption of cloud technology today very well could lead to a data compromise tomorrow. This is the risk we should be concerned about, and especially the long-term risks associated with that, which I'll touch on in a minute. Now, healthcare by its nature is not necessarily a high tech savvy industry, not when it comes to sophisticated cloud security deployments, especially now, while being short on resources and having to even further prioritize not only patient care, but also the safety of their own staff. The industry has suffered a huge increase in attacks triggered by the pandemic. The WHO, so that's the World Health Organization, has reported a five-fold increase in attacks against its staff. It is up to interpretation whether some of it is political, as WHO is facing quite a bit of backlash for allegedly mishandling the pandemic, especially in its earlier stages. Google had said it had detected more than a dozen groups using COVID-19 themes as bait in phishing and in malware traps, and that it has seen attacks launched by the Iran-linked threat group named Charming Kitten, which I'm going to touch on later, against medical and healthcare professionals, including employees of the WHO. The DHS in the UK, NCC, so the National Cybersecurity Center, issued a joint statement that APT groups, so advanced persistent threat groups, that's nation-state actors, larger groups, state-sponsored, we're talking sophisticated, well-funded groups, we're targeting healthcare's response to supply chains, and in some cases, intellectual property. That's kind of a new attack vector. Like, it used to be very particular in regards to pharmaceutical companies. But at this point, in regards to COVID research, we're definitely seeing an uptick in that, because obviously this would be huge. If you're China, I'm not pointing any fingers here, but if you're China, if you're Iran, if you're any country, getting your hands on a vaccine research, especially the one that's very far along, a successful one, that really puts you on the map. That gives you a tremendous amount of socio-political, geopolitical leverage, and it really puts you at the forefront of that financial battle for distributing the vaccine and obviously benefiting from that fiscally. right? And again, last but not least, there's an inherently vulnerable and unpatched surface of IoT devices and just other medical devices and non-medical devices as well within hospitals that introduce additional uncertainty and further increase the attack surface. While prioritizing regulatory compliance and patient safety, hospitals and pharmaceutical companies can be hostages to bureaucratic processes that hinder fast action and rapid deployment of new technology. And we'll circle back to this a little bit later, but it's a big problem because as new threats occur every day, and they evolve much faster than the technology does within a hospital. So just a number to throw at you. So we've seen an increase and an uptick in cybercrime attacks against healthcare in particular, been up by 58%. And this is the official data, and this is since last month or so. So could be even higher as of now. But despite the well-documented increase in attacks against the healthcare industry during the COVID-19 pandemic, the industry is largely coping well against the cyber criminals. You'll see this on our next slide. But nevertheless, the necessary and dramatic migration to cloud-based services, to telehealth services, will undoubtedly leave the industry more exposed in the future, especially long-term. I mean, the damage has been massive as it is, even in some particular individual cases. Let's talk about pre-COVID-19. You might remember the Anthem incident, right? So the breach occurred on February 4th, I think, 2015, but was only discovered a few weeks later. So Anthem later settled for $116 million, which seems like a lot, while admitting no wrongdoing. Now, again, if you look at the settlement, its price per person affected, the total comes out at $1.45 per affected record. This makes it seem like Anthem got away too easily, and that's not exactly inspiring for the actual victims of the breach. And the consequences can last for years and years. I mean, think insurance fraud, think impersonation, you name it. You can't easily change that information. And not to mention that some people are just kind of winging it. They're not, I mean, I'm part of a Life Labs breach. I'm now part of the class action lawsuit also. But it's going to take some time. And that's not to say, I mean, it's okay, so you're going to receive the compensation, but that doesn't negate the fact that your information is now potential on the black market. Not to mention that the attacks are arguably getting worse. We're talking cyber assassination possibilities here. Just this month, for the first time ever, so that's September 2020, if you're watching this sometime in the future, a patient's death in Germany has been linked directly to a cyber attack, to a ransomware attack, actually. And police have launched what they call a negligent homicide investigation after ransomware disrupted emergency care at Dusseldorf University Hospital in Germany. A female patient from Dusseldorf was scheduled to undergo critical care at the hospital, much like the scenario I've opened this up with. Not quite, but similar. When the September 9th attack disabled the systems, and it was a ransomware attack, as I mentioned. And when Dusseldorf could no longer provide care, she was transferred 19 miles or 30 kilometers for people in Canada here, away to another hospital, and unfortunately passed away. Ransomware is a billion-dollar criminal industry. Hackers often target businesses, shutting down technology, exfiltrating data, before demanding up to millions of dollars in extortion money. Hospitals have been hit many times before, and as the criminal economy grows rapidly in the near future, it grew rapidly in recent years, it was widely feared that a patient death was inevitable, and here we go. It's sad, really. Now, this is not to scale, obviously, the chart, but let's focus on the numbers. As I mentioned earlier, the WHO has reported a five-fold increase against attacks on its staff, and Google has seen a huge uptick, again, especially in regards to APTs and some of the more sophisticated threats. A lot of it was email campaigns. As you can see, the majority of attacks during the pandemic has been delivered via email. That's meaning mass spam campaigns have been taking place, campaigns impersonating your governments, impersonating WHO, claiming it's your employer, needing you to sign up for COVID-19 benefits or various other healthcare benefits, or renew your health insurance, or just sign up for COVID training. It's been pretty sophisticated, to be honest with you. And this is backed by the fact that in March alone, for example, it's way back, 40 Guard Labs team, which is a competitor actually, so 131% increase in viruses, which should come as no surprise considering email attachments are the most common vendors of such malicious content, right? But you would see that there has not been necessarily a corresponding uptick in breaches if you look at that at the chart, right? So here's the thought. The number of attacks has not necessarily had an increase due to just the COVID-19 crisis directly, but what has increased is the attack surface of unmanaged cloud services in a short period of time, which was indeed the consequence of the pandemic and the healthcare's reaction to it, right, with the digitization. I call it the forced digitization. But again, now interestingly, there was no increase in corresponding breaches despite the increase in attack activity. Now that suggests that the healthcare's current security posture is holding up seemingly. But this may soon change, caused by the rapid forced increase in attack surface due to migration of the unmanaged cloud services, additional IoT devices, telemedicine, and whatnot. And what worries me is that this is a long-lasting change, right? Once you go out there, it's very hard, nearly impossible to undo it, to roll back, and I think what we'll see is that when cybercriminals will evaluate and narrow down the attack vectors associated with this newly deployed infrastructure, we'll see the breach statistics catch up to the currently evident attack number. And well, it's not a happy thought. This means that the time to act is now. Obviously, if you're a cybersecurity professional of some kind in a healthcare institution, then definitely want to think ahead of time and not just being reactionary. If you're looking at the attack and threat landscape here, you can see that the top patterns are, denial of service, cyber espionage, again, in regards to some of the IP, COVID-related, and vaccine research-related IP in particular, not to mention pharmaceuticals. This has been very steady across the last couple of years. You see some POS, mostly at pharmacies, that sort of thing, payment card scams, and obviously ransomware as well. Now, healthcare is one of the few industries where there's a very interesting, almost a 50-50 split between internal and external threat actors. If you look at the threat actors infographic there in the middle, this does include non-malicious threat actors, by the way. So, and I'll explain. When we're talking about internal threat actors, which, by the way, is up, it's been up about 162%, I think, over the past 3 years. Unauthorized access is already a massive issue. Nevertheless, it is still growing at an astounding rate. When I say unauthorized access, I'm talking, it is pretty typical to grant admin access or elevated access to physicians at a hospital that can see each other's files and patient files, and otherwise they can share these files. So in some cases, a single entry point can allow your attacker to move laterally, right? So horizontally, again, access to this physician's notes and this one and that one, and then the pharmacy information, and just go nuts, right? So it's very flat. But negligent breaches, which are a type of internal threat, are defined as those that occur as a result of internal mistakes. So leaks by accident, misconfiguration, granting elevated permissions mistakenly, what I just described. Now, in contrast, when we're talking about external forces like hacking, they would typically fall into the malicious category and external category. You don't usually kind of stumble onto a hospital, sensitive information. You don't exfiltrate it to the black market by accident. It's usually very deliberate and financially motivated. And there was a study recently that found that over, I think, 1,400 breaches were negligent and about 700 were malicious, which is threatening. I mean, it's not a happy figure because it's the lack of training, it's the lack of internal controls and governance in a hospital, not necessarily perimeter defenses, that are responsible for these figures. And healthcare hacks are a great threat, and human negligence it's you can't overestimate that as a factor. It's responsible for a big part of why that is once again one of the most prominent industries that are being attacked quite a bit, alongside government and financial, obviously. Circling back to external attacks, ransomware attacks in particular, again, are becoming more common as cybercriminals find more ways to hold entire systems hostage. And, hackers can lock the approved users out of the system, as well as collect and hold data captive until their demands are met, and effectively deny patients the care that the hospital provides. Like an example I used when I opened this talk. The thing with ransomware is that it's far from a new concept. You see, back in the day, it was just as possible to infect systems with an improvised ransomware, albeit maybe less sophisticated than now. But the challenge was getting the payout. How do you get paid without risking the money being traced to you? Do you ask people, to leave a suitcase full of cash on the corner? You can get it wired to you because that's going to get tracked and traced down to you pretty easily, right? Like, do you ask them to pay you cash? It was a big challenge, I mean, honestly. And sadly, one of the side effects of the booming cryptocurrency technology these days is that it makes linking payments to particular individuals extremely difficult, impossible in some cases. And this is a big reason behind why ransomware is such a popular attack vector, simply because it became more financially feasible to carry out these attacks. And, the payouts are greater, and people are getting bolder, but really it's just the feasibility of such an attack that has been a huge factor. And the second kind of piece of the pie here is that PII and PHI themselves are very popular targets because of their inherent immutability, in the sense that unlike a credit card, they cannot be easily and quickly blocked or changed. You're stuck with it, whether that's your social insurance number, your name, or some of your PHI information, such as your particular health information, and some ailments you have and whatnot. Like, this can all be used for insurance fraud, for impersonation, for bank fraud, you name it, and it's you're stuck with it effectively. And some people don't frankly care enough to change it. In the Life Labs attack, for instance, in Canada, obviously we're talking about, there has been almost no attempts to actually counteract this. I mean, there's a class action lawsuit, sure, so people can potentially get a payout, but that doesn't negate the fact that your information is out there in the black market potentially, and somebody is impersonating you, and you can see these consequences years down the road. Let's talk about some of the risk factors that we're seeing in the healthcare industry that are driving these issues. Well, healthcare is transforming itself as far as possible into an online service with massive dependencies on the cloud and some of that legacy infrastructure. And it is doing so at a rapid, forced pace, inevitably increasing cyber risk. Inside hospitals, we see all kinds of affected devices. I mean, even non-medical devices such as network switches and printers, while not directly connected to patient health, are still critical to the workflow of providing medical care and to hospital operations and to their day-to-day. And they can be targeted, and quite often their legacy, and it does not, it is not an obvious and immediate thought that, oh, these are also part of the medical devices in this context. And people who target medical devices, like most cyber criminals, are usually motivated by money. It is more likely they're planning to launch a ransomware attack to, or find medical records to sell in the black market, because again, healthcare data and PII, PHI can fetch a higher price than credit card numbers, for example, because it can't be changed easily. And attackers may also seek to cause market manipulation in some cases by targeting a major healthcare organization with a cyber attack, but usually it's financial. And again, part of that now, it's also geopolitical, right, and socio-political for leverage, for IP, for that vaccine research. It's a big market out there, and it's very important to some countries to get ahead of the game in that regard. Healthcare providers, on the other hand, are obviously driven by a need to treat a growing patient population, larger than ever these days, especially as we're getting into the flu and cold season. People with colds will think they have COVID. People with COVID will think they have colds. It's going to be a mess. There's a huge national rollout of immunization and vaccinations when it comes to cold and flu, right? So again, people congregate in the same area. Hospitals are backlogged on the actual vaccines and the shots, and it's tough. So hospitals, as much as possible, they try to provide more telemedicine and attempt to stem rising healthcare costs. And technology can help them do this. However, the integration of connected services may also put patients and data at risk. So the reality that we face is that medical devices can be in the hospital setting for 15 to 20 years, sometimes more. But new cybersecurity threats are emerging daily. And this was by Rob Suarez, who's a CISO at a medical technology firm, Becton Dickinson and Company. So in a panel held a few months ago on secured connected health. And as cyber attacks continue to increase, many hospitals still lack a dedicated security expert or a CISO or a team, and they don't conduct, simulations or tabletop exercises. There's no, a coherent cyber incident response plan with particular playbooks. Step by step, talking like scenario-based, very specific playbooks covering communications and everything, which is exactly what we help do. So I know for a fact that it's not rosy out there. And medical devices are especially vulnerable compared with other IoT devices, PCs, and smartphones, because most of the connected medical products we have seen in hospital environments have a cybersecurity standards from 10 to 20 years ago when they've been initially deployed. And they typically have different kinds of vulnerabilities and problems. And many of these devices have issues that are associated straight up with design flaws, right? So they can have poor means of authentication or connections for receiving telemetry or managing and configuring a device. And there's not much you can do with that because it's a legacy device. And you can't deploy it and redeploy the new version of it just as easily because of the continuous healthcare and patient care requirements that you have to take into consideration and the costs and your priorities, quite frankly. That's a big challenge. Now, the community is obviously, it's not an isolated problem, so a community is responding to that in a certain manner, and healthcare is a broader topic than cybersecurity. I mean, it is not only an essential service, but also it's hugely beneficial one within the scope of the global healthcare crisis and outside of it. I mean, health is everything, right? And cybersecurity resources throughout the pandemic, and they understand that helping the healthcare sector fight off the threat means fighting the good fight, right? Like our organization, Wembley Partners, we actually release a whole bunch of, we do pro bono these days. We issue free threat reports, help hospitals massively. And this has been a trend in the cybersecurity community lately. And I'm very happy and very pleased to see that. Now, we've also actually had some interesting developments this year on the other side of the barricades. So for example, when a gentleman named Lawrence Abrams, who is the creator of Bleeping Computer, which is a popular computer help site, reached out to the cybercrime groups of some of the most prolific and dangerous ransomware threats. And he asked a simple question, whether they will continue to target health and medical organizations during the COVID-19 pandemic. And their answers might surprise you. There's been a few of them that responded, and the first to respond was the operator of the Doppelpaymer ransomware threat, which is pretty prominent, who told Abrams that they always try to avoid hospitals and nursing homes. And when attacking local government targets, they do not touch 9/11, according to them, although sometimes emergency communications are hit due to network misconfigurations. And interestingly, they also has said that if a medical or healthcare organization does get hit by mistake, then they will provide a free decrypted code. That's according to them. But the thing is, pharmaceutical companies are not included in this ransomware amnesty because they earn a lot of extra on the panic, the criminals said, and adding that they have no wish to support the pharmaceutical companies in this. See, the thing is, though, Doppelpaymer is an example of what Microsoft refers to as human-operated ransomware, causing havoc with ransom demands that use exfiltrated data as a leverage. So this is where the promise kind of falls flat because the risk to third parties remained. It could still happen. And again, this is just, this is one or two admittedly large threat actor groups, but then we see a lot of threat actors still going at it and leveraging this pandemic, and healthcare is obviously a big target. Look at WannaCry, look at all of those, look at the Dusseldorf situation this month. And unfortunately, this remains a big problem. Well, folks, thank you for the questions. Hope you can hear me, and thanks for watching the presentation.
So I see a few questions come in. The first question is, you mentioned that the US is losing 7 billion per year in normal times. Any idea of what this number will be by the end of the year due to the pandemic and an increase in cyber attacks? So that's an excellent question. Unfortunately, it is very hard to actually provide an answer. One of the reasons for that is, the question here is, when is the pandemic going to be finished? Right? Because we're getting into the fall season. We kind of see a resurgence here in Canada. Obviously, across the US, it's been it's been a surge as well. So the question is when the pandemic is going to be done, really, because I think we're going to be in exactly the same situation next year. I would say, at least 30 to 50% increase, right? Because we've seen a rise of cyber attacks, but you can't discount the associated costs, such as the cloud transition, right? So we're not just talking about the breaches, and there are additional infrastructure costs, there are additional, mitigating control costs that are associated with that. So I would say it's going to go up 30 to 50%, but again, don't quote me on this number because I'm just as lost as everybody else trying to figure out when is the pandemic actually going to get wrapped up, more or less. And there's another question here as well, also an excellent question. It goes like this. It says, it's hard to replace devices in healthcare that are not on par with today's risks. What would you recommend? So again, excellent question. So there are two components to that into mitigating the risk, right? So one of them is, preventing or detecting the risks, and the other component is actually responding. So in this case, if it is really difficult, if at all possible for some healthcare facilities to actually prevent these cybersecurity risks from being realized, through these unpatched devices and from outdated devices, I say you got to focus on actual incident response. So that cybersecurity incident response, you could potentially introduce things like threat intelligence sharing, right, within the hospital networks. So that basically means that healthcare providers and the government, for instance, can share things like indicators of compromise, information on threats and APTs and ongoing attacks, and be proactive about that. I would also make the same recommendation to the financial industry. Now, the second thing is the actual response, right? So that means working with cybersecurity vendors in regards to, let's say getting in incident response retainers, creating plan and playbooks, and actually putting certain procedural controls in place so that once the cybersecurity incident actually happens, and there's a pretty high chance of that, the staff inside the hospital knows exactly, how they're going to work with the vendors, how they're going to work with their partners, what should their internal teams, whether they're IT teams or crisis management teams, do. And I think that that could be pretty good from the mitigation standpoint. Yeah, I guess that's it. I do appreciate everybody watching the presentation. Don't hesitate to contact me, to reach out. Always happy to chat. And thanks again for attending.